Wednesday, set up community center-based testing programs? And the short answer is no. The longer answer is that we need to develop testing capacity greater than we have now. There's a national shortage. It's not that we don't want to test more people. It's that we're having trouble testing our folks in our nursing homes adequately, in our hospitals who are could have COVID-19, but are persons under investigation, and the delay in testing to results is far too long. So yes, as we develop more testing capacity, we will want to reach out into the community, reach out into detection from a public health perspective, do surveillance, and develop a real model of this disease. We do test about 2,500 to 4,000. Those are the numbers of results we get each day. So depending on where they were tested in a hospital, that may have a 24-hour turnaround, or the state lab may have a 24-hour turnaround, or it may be 7 or 8 days if it's a commercial lab. So once our number one job is to increase the capacity and the rapidity of testing. We mentioned the other day that we have received from FEMA 15 devices from Abbott that can do testing within 15 minutes, but not the adequate supplies to do really any significant testing at all. So I think your point is well taken, that as we develop capacity, we will need to develop those plans to best use those for both communities that are at high risk, for vulnerable populations, as well as for better public health understanding, as the governor alluded to, so we will know from an evidence-based perspective how to reverse and get back to normal life in the appropriate, safest, and most responsible way.
And it's sort of with what Dr. Carey was talking about, I was going to ask about testing capacity. I know Governor Hogan announced today that they've made an investment with U of M to ramp up to potentially 20,000 tests per day. I know national reports have Virginia sort of near the bottom with per capita testing. What avenues are you all exploring that you maybe haven't already discussed with us about increasing that testing capacity?
Great question. I think it's both the quantity and the delay in testing. So actually immediately following this session, we have brought together actually McKinsey, a consulting group. That's how can we get better in Virginia? What are the lessons that in my conversations with other states, whether it's Michigan, Maryland, or North Carolina, they're doing very much what those states are doing. But what can we do better? How can Virginia be the leader in testing? And we don't know those answers, but we are aggressively seeking those answers.